The COVID-19 pandemic has overshadowed non-communicable diseases, yet they remain a big health challenge globally. People living with non-communicable diseases are the most affected by the COVID-19 pandemic and face severe complications when infected due to their susceptible immunity. In Uganda, few or no measures have been taken to protect persons living with non-communicable diseases, especially or hear what they go through, since there are hardly any platforms for voicing out their needs and challenges. Uganda Non-Communicable Disease Alliance (UNCDA), with support from Non-Communicable Disease Alliance Global through Solidarity Fund Phase 2 of 2021 on NCDs and COVID-19 project in 4 out of 11 UNCDA supported districts of Luka, Serere, Tororo, and Nakasongola. This fund was aimed at mobilizing persons living with non-communicable diseases to voice out their challenges and needs, especially in the era of COVID-19, and to create platforms where persons living with non-communicable diseases can interact with policymakers and meaningful involvement. During the 6-month grant implementation period, UNCDA mobilized, sensitized and supported persons living with NCDs in 2 groups at health center level to carry out meetings to strengthen each other, voice out their needs, and propose possible solutions to problems they face during the pandemic. Persons living with non-communicable diseases and facilitators share experiences in regards to NCDs and COVID-19 effects.
Wano wendwalira ntira okwida ku wano bankeberaku era omusajja okunkeberaku duzi naida mu mwezi gweno ogugwireku naida ano okunkebera omusawo yankoba ati muna presa yekoze eki eninye olwero bwasooka okunuma bwa asthma bumazeeko emyaka nga 13. Ekifuba kino nziwira kyane sibanga tisobola kuwera era bandandabira wano bajja bankupe kuidagala mu misiwa muno mena abane emirembe.
When I went for testing and I found that I have pressure, and this pressure I developed due to the first lockdown because I have children, and the only source I had it was my job, and we were locked down. So due to that, I developed pressure.
The type of NCD I have is a high blood pressure. I came to know about this disease when I was seriously sick, and I was taken to the hospital. Now when I was introducing myself to the doctor, so he looked at the sign and symptom of my communication and said, we are going to test for high blood pressure. We are going to test for diabetes.
In the same meetings, participants revealed the challenges encountered in the COVID-19 pandemic situation.
I've suffered with pressure for 2 years. And the challenges I've faced during this COVID-19 pandemic, the problems I faced was lack of money to buy the drugs and also accessing the health facilities due to the COVID-19, the lockdown.
As we are not to move, I find difficulty in moving because sometimes I go to the main hospital when the waist pain is too much. So getting transport money is a problem.
Participants too suggested different solutions to the first challenges.
Now I have a request. If the NGO or the government can help us, the patients, could avail us with the machine for testing high blood pressure within the LS center, or sometimes the LS center is far and you can be attacked at any time, and you also need to know your status at any time. maybe they can extend the machine in the village.
Ndi ku suggesting anti bano bafunds abayita musana akasente abatyamiza wano ndi basaba ni government nti ebikozesebwa mu idwaliro ndi basaba nti babiteewo in plenty kuba n'ekindi kyendi kwenda nti mobilization mu kyalo ebeemu ningina okusomesa ino abantu mu byalo n'okwongera otraininga abasawo baife abali ku facility.
During the persons living with non-communicable diseases meetings, some respective health facilities in charge and other meeting facilitators shared information on NCDs, self-care and prevention.
Kitundu ekyaswa kina kubaamu greens na fruit setegeza kulina kubako dodo ikubi avocado mulibona ekitundu kyeswana ekisooka then kakota akaswana kakota mukategera nakayina okubaako nti bando mutiyere then kakota akandi nakayina kuba budandaali wolya suwani eyo otyo okumala omwaka mulamba ojja kuba okendeire niwo buli muzito ojja ebintu ebindi kuba ebiri greens ebyo ebindi by'ovacado binazaamu mu mbiri ebikyafu.
For us, we have made it mandatory that every adult above the age of 30 years we check for blood pressure. So the machines that we received actually have helped a lot, because right now, since we introduced the mandatory checkups, we've realized that the number of clients that we are getting with NCDs has increased.
Basically, when we look at NCDs, non-communicable diseases in the district, we have a very, very big challenge. A lot of focus has been put on HIV, on TB, and but very little has been put on combating non-communicable diseases. We have problems like, for example, I'll give you an example. In Abisura Health Center 4, we have about 5 to 6 patients who constantly come in wanting insulin, injectable insulin. We have, on average, every clinic day in Abisura Health Center 4, we would have about 10 to 20 patients suffering from high blood pressure, coming for drug refills. The medication that we get in our health center 4s will cover just a few patients.
However much NCD is trying, however, the community still needs more campaigns, more information about NCDs. Some of them are living without knowing they have the NCDs.
Other participants attending the dialogue were community opinion leaders, supporters and well-wishers in 8 health facility service communities who shared perceptions on NCDs and NCDs services.
Nale bulungi ekyeigulo n'alamba dyesa musanvu n'atandika okufuka wajja okukya kunchonga baafu ibiri n'awuna enkyo n'ajja mu idwaliro ojokebera nga sukaali ali 27 bakaba omusaadde eyo oli musawo tujja okwekebera bikoze mba tibayeeko na sayini yona
ne bankebera naye nga teri nnuma n'okunzijjako akanyama nga teri nnuma ekimu kyonna nga tekinnuma era nga nze mmanyi nti bagenda abaana ne bangamba oba amabeere abiri mwe mulimu akantu bagasaleko gonna. Ekikulu nina omwana asembayo omulenzi myaka 25 last born wange nino emyaka 61 naye nga tebadde ng'ogenda mu ddwaliro ng'obuuza bana akantu kali nkole ntya ne bangamba kalina kuvaamu tugenda kajjamu bujja ngeri gye nafunamu pressure ntonotono naye tugenda kujjamu ki kantu era ngenda okumanya nti ebbere baliggyeko nga nvudde mu theatre naye mbakubiriza kabeere nga kali wano mu mukono akabeere nga kali mu kugulu. Nze nina muganda wange ali abamuziika wano Reverend Kanoni Waalu yeekona bwekonyi ku ntebe naye tugenza omuzika ali wano ewatte basuulwa wano tugenza omuzika nga amagulu abiri tekola ki tegaliiko kwekona bwekonyi
idwaliro biwasho luwanika eshuma otaho nyowanongo gigang'weshimani piyo piyo.
The purpose of her request is that at time they move up to the health center 3 most times when they reach the health center 3 they find that the machine or the gadget they use there for measuring their pressure or whatever they are suffering is dead.
Ani atonga paran maduong' tatake. Idakuya kirino yaurwe Kenyo clinic.
She also didn't even know that there is a particular department.
Rupira maro pino kumira, okay?
She used to go there for testing.
Akidanie wanyewe ye.
She used to just go and buy her own drugs.
Takwayo ne luenyiruwa wini be wanu wangu ye ni mawa niti clinic mawa no.
She is requesting that let there be department where they can also go and get the drugs from.
Okusooka emyaka gibisewo nalwala omutima nga ndi muvubuka wanuma emyaka gyayera 14 naawona bwenawona akabonero ekizibu kyasobola okufuna butanwa maadi paka olwalino maze emyaka gyera kamaala uti 18 kino tuwulira nonto y'amaadi ngano just buno okukuba nti kyeyagalire ayi ningensiba mukasana ningenkola emirimu tuwulira nonto y'amaadi egano ekisebe kyabita nga bisobola ndowooza emyaka giri 4 najja okwekebeza ati pressure akoze eki andimi najja nga ndi mulamu wale bukanga.
Participants also had different perceptions on COVID-19 and COVID-19 vaccination.
I got affected with diabetes. I was getting his treatment from Bukang Health Center 3. But when I always visited the health center, they were eliminating me because of COVID. When the health workers doesn't want to attend to me, when they are suspecting me to be a victim.
Lockdown kyakusanze nga kifuna idagala aye Katonda yanamba nti pegana kutino bwenye okwekebezaako aba mu 13 kinana olusi 35 kinana atu
yatukosa ino kuba ndi omu ku bantu ababitibwa n'amaze okufuna okukeberebwa nga ni sukali mwezi ogw'omusanvu na kwete omwezi nga ina.
So for social media, when somebody who had already got the vaccine and they were trying to put a bulb here that it lights, when you put a magnet anything it remains here. So those are things that are scaring people from getting the vaccine.
Only rumors, but I don't know what that thing is. But only rumors for that. Some people can say that thing is not good, you can pay in here a lot. If you finish 3 years, you can die like that.
The dialogues also acted as platform for sensitization on prevention and control of non-communicable diseases and COVID-19.
Most of that information is myths.
So, do job e joko na lo city. Ije inoto jo serera center. Ije bere bono joko no. Nada inoto jo kati kadungu numina. Ache para tamine ngasama ene kadungu. Ota no kansa mina. Mami mambere chunyonyo e katolo yo. Le corona. Ere go jabu ne ra papai. Do na ti de munara akima papai.
Let's count ourselves fortunate that we have the COVID injection vaccine being administered in Serere Health Center. Some of these health centers, those people are far and they rarely get that vaccine immediately. They also have to come back here to Serere. Well, we had a number of issues they came up with as to why they were laying fears not to go for vaccination. We have tried to talk to them. Let me hope that this sensitization we gave them will be able to open them up and go for vaccination.
Groups tufune engeri gye kituyambamu ebintu bye twetaaga okubeera okati ng'omulwadde wa sukaali wetaaga okubanga okebera sukaali wo oluvannyuma lw'obudde.
Mu gurupu eno buli kirwadde tulina be tukaddemu. Abalwadde b'ensimbu balimu nga 3 naye nga bagenda beera n'ekitabo bawandiika abalwadde baabo bonna. Kati bano 3 be balina okujja balinga boogezandi abalwadde b'ensimbu n'ab'essukaali nabo balimu ng'abantu 8 bwe batyo naye nga lisiti yaabwe mu kitundu bonna baliwa bali mu katabo.
Dr. Agaba Biamukama, the District Health Officer, Nakasongala District Local Government, while addressing the community dialogue, highlighted the importance of NCDs clinics in health facilities.
This observation is as a result of knowing that there are many people who have NCDs and who are not aware of their status. And the moment you put the clinic once a month, some of these people will be denied the opportunity to access the right health worker who can do the needful to see that they are served very well. And also people who have chronic illnesses need more time with the health worker. The moment the clinic is running once a month, you will have many patients standing up on a particular day and you will not have adequate time to be able to sit with them, counsel them, study their problem and treat them appropriately.
District-based dialogues were also conducted in 2 districts of Luka and Tororo to discuss the findings from the project so far for an all-inclusive way forward to improve NCD services in the era of COVID-19.
Apart from the IEC materials, the Chief Administrative Officer and you, in your budget, your health facilities, put in also the equipment required. Like he said, if we can have a temperature gun here every now and then, a temperature gun, what about just some blood pressure machines and some of those other things? That's a big price.
You do not want to lose the heart of humanity because somebody is bothering you because they have diabetes, because they have this, they have hypertension. This is still our role and responsibility.
If it was a pull system, like in hospitals and health center force, I think we would be able to requisition for drugs that we need at our level as well.
We can do on-site mentorship and incorporate also CMEs on NCDs to bring these health in charges on board so that we are sure they can be able to do what? To provide the correct treatment and support for our clients.
The issue of drugs. These drugs like metformin and metformin and maybe the other drugs meant for high blood pressure, whatever. Are they under the essential drugs? And if so, why don't we ensure that at least these drugs are there continuously? And at our health facilities, and actually all of them, all the health facilities in the entire district, so that people can easily access them. As he puts it, they are very, very expensive. And this is a person who takes drugs the rest of her life. It's like a lifetime exercise activity you have to fulfill. And they are very expensive altogether. Is it under the essential drugs? And if so, can't the ministry improve and say that we have these medicines constantly?
District COVID-19 task forces made some recommendations in regards to persons living with non-communicable diseases.
First instant screening to be done by the health workers. When someone comes and presents with any sickness, first screen for some of these NCDs. And then 2, governments should make available the IEC materials. And 3, the medicines should be available.
But also as a district, we're ensuring that we plan for equipment. Wherever a patient is able to come to the facility, they are able to check themselves and also be able to be attended to.
But of course, other than sensitizing, we are going to ensure that we tell them that they should also take medications timely
because the time, if you don't adhere to medication, I mean, you'll not survive. For example, diabetes.